Hello, my name is Cindy Medeiros, and I will be graduating from the University of South Carolina's College of Nursing in May with my BSN. With graduation coming around the corner, I will be looking for a registered nurse job within the Boston area. I am confident that I will be hired because I love and strive to learn new information within the healthcare system and am determined to provide the best quality care to my future patients. Within the first couple of years as being a registered nurse, one of my goals is to include myself in as many new experiences and educational opportunities as possible. I'm a visual and hands-on learner and already gained so much information and knowledge within my clinical experience as a nursing student and within my job as a patient support tech, which makes me certain and confident in my ability to learn, grow, and adjust within a new facility. To ensure that I reach that goal, I will always ask other nurses if they would mind me watching or helping them with a new skill I have yet to learn. I will ask my seasoned colleagues questions that come to mind, and I plan to keep my knowledge and skills up to date with the best evidence-based practices. Healthcare is always changing and evolving, which with new technology and new information. So I find it best to always research best practices, which allow me to better myself as a nurse, which leads me to take better care of my patients. In terms of being a leader within my facility, I tend to follow a servant leadership style. I want my coworkers to feel heard and confident within their skills as a nurse. I think the best environment for a leader is to be surrounded by other great leaders. I would like to encourage the people around me to always use their adapted leadership skills to help the facility work as a whole. I also find characteristics within myself that align with the transformational leadership style. I consider myself to have great emotional intelligence. I can usually understand how someone is feeling by observing their behaviors and demeanor. I am very empathetic and love leading people to bettering themselves. When it comes to making decisions, I appreciate other healthcare professionals' opinions and experiences within the subject. I believe nurses and healthcare professionals experience so many different opportunities within their career, which can lead to great insight when making clinically sound decisions. When communicating with other professionals, I find it important to actively listen to what they're discussing and to always summarize the content at the end of the conversation. When a professional is communicating with me, I like to repeat what they are asking me to make sure I'm understanding. And in certain situations, I like to give different options and outcomes to the advice I am giving them. I like to view the bigger picture in most situations because it helps me analyze how different actions will affect the situational outcomes. While practicing these communication habits, I also like my communication to be firm and concise, and in order to keep it as simple as it can be while obtaining the right results. To do this, I like to use the SBAR format to help me stay organized and concise when communicating with others. While looking for an organization to foster my future career, I tend to look at their awarded recognitions and their rankings as a hospital. I want to ensure that the organization I work for provides me with the resources and education to strive as a new graduate nurse. I trust that a magnet designated hospital truly equips their nurses with resources, education, and compassion, which ultimately leads to an increase in employee satisfaction and retention and improved patient outcomes. An organization that I would love to be a part of their team is the Massachusetts General Hospital. Their mission statement reads, "Guided by the needs of our patient and their families, we aim to deliver the very best healthcare in a safe, compassionate environment, to advance that care through innovative research and education, and to improve the health and well-being of the diverse communities we serve," which is evident through the multiple recognitions and accreditations that they have. Mass Gen was the first hospital in Massachusetts to be awarded with magnet recognition back in 2003 and has since been awarded it multiple more times. It is currently ranked by the U.S. News and World Report as the #1 hospital in New England for the 2022-2023 year, and is also ranked the #1 hospital in research in America. Through reading these reports and other articles on Massachusetts General Hospital, you can truly understand that they care so much about their patients and the environment they put them in. They care that their nurses strive to improve these patient outcomes and work interprofessionally with other professionals. By living just outside of Boston for my whole life, I got to hear all of the great things Massachusetts General Hospital has completed as a facility. They truly strive in making sure patients feel safe and comfortable while receiving the best quality care that they can. These recognitions depict how Mass Gen grows the best nurses and continually finds and uses the best practices through research, which is why I would be honored to be a nurse within the Mass Gen team. I want to thank you all for taking the time to get to know me and watch this video, and I hope you have a great rest of your day. Thank you.